and stressful time, but reports have emerged of physical and verbal violence directed at birthing mothers in South African hospitals. For more on this, we're joined by Bhekisisa contributor Regan Boden. Regan, thank you very much for availing yourself this afternoon. Let's unpack that term, obstetric violence. What are we talking about?
Hi, Dudu. Thank you for having me. Obstetric violence is a term that we use to describe any threatened or actual physical or verbal abuse that is put towards people while they are pregnant or during the childbirth process.
How far and wide is this practice in South African hospitals?
That is part of the problem, Dudu. We really don't have a good idea of how common this is. Speaking anecdotally to my friends, my colleagues, this practice is relatively common across the country. Part of the problem is that there is no publicly available data set, nor, as far as I can tell, is there a regulatory body whose sole mandate it is to collect this data and to ensure that this problem is being addressed. There's something we say in public health, and it's called what gets measured gets changed. And I think as far as we don't have an idea of how widespread the problem is, we have little hope to make sure that we address it fully.
I do wonder why, whether it's people do not actually complain, but I guess you'll be able to help us with that answer when you tell us about your own story in terms of what you witnessed.
Yeah, I think what's important to remember about this story is that I've actually, as a healthcare professional, as a medical student, witnessed many situations like the one I wrote about. And the story is intended to play a placeholder for the healthcare workers across the country who have witnessed or even experienced similar abuse. So I tell a story in the piece about how my first call actually in my maternity ward in my 4th year of medicine, how a woman was getting closer and closer to delivering her child. But obviously labor is a really intense process. There's a lot of emotions. It's really physically straining. And this woman was really getting towards the end of her tether. And in the story, I speak about how one of the midwives who was attending the birth became increasingly agitated at the woman and ended up physically slapping her. That's sad to say, wasn't the last time that I've seen someone being hit during childbirth, but it definitely was the first time. I think the piece is a valuable way for me to reflect on how I felt in that moment and what it does to me as a healthcare worker in the future.
Interestingly, in 2011, Human Rights Watch spoke to 157 women in the Eastern Cape alone. So even back then, this has always been a persistent issue in the country. You speak of us not having legal frameworks that actually attends to this issue. Are we the exception to the rule, or do we see that other countries actually have a handle on this?
No, we are by no means the exception to the rule. The only real example we can look towards that's doing a really good job in this space is South America. There's actually 5 countries in South America that have written the term or the concept obstetric violence into their legal framework for violence against women. And at this stage in South Africa, even our latest and first action plan on gender-based violence has no mention of obstetric violence or disrespectful maternal care. But you know, as I said, we aren't alone. I think most countries around the world just lack the legal and social framework to deal with this issue.
Sure. I just wonder, in the case of the women that you witnessed being abused by healthcare givers, to your knowledge, did they report the incidents?
I think that's another problem, is that, you know, people, when they're experiencing these intense experiences, there's no real guideline on how to approach the reporting of this. Whether people are reporting these incidences, but they just aren't being publicly published, is a different story. There's no way for us to say. But from my experience is that, you know, if you're experiencing or a victim of this sort of abuse, in the moment, there's real lack of clarity on how to actually handle this experience.
If you speak to a number of young women, especially who would, you know, use public healthcare spaces, they will tell you that even prenatal, when you go and you get checkups, you will get insults from some of the nurses. Those are just some of the experiences that they go through, especially if they're young and if they're pregnant. So you get to a point now when you're giving birth that you actually get physically assaulted. To your knowledge, did you witness this, where people will are already being abused even before the day they give birth.
Definitely. There's an interesting researcher, his name is Jessica Dutton, doing their PhD at the University of Western Cape. She witnessed a lot of the antenatal care and the ways of violence is perpetuated in that space. And I had a conversation with her. Unfortunately, I didn't able to speak about it a lot in the article, but she spoke a lot about this idea of undesirable reproducers that is perpetuated in the healthcare sector. Like you said, maybe young women, maybe older women, people who healthcare workers or even other patients feel like these people shouldn't be pregnant. And in that way, starts to extend violence even from the first time they meet.
Undesirable reproducers. I wonder who gets to decide. Thank you very much for availing yourself this afternoon. But before we let you go, now what, right? So we're having these conversations. We do know of these stories. But what can we do? What kind of work is being done to maybe egg on those who are policymakers to actually draw up legal frameworks around this?
Well, encouragingly, there is a lot of groundswell of advocacy in this space. I'm speaking from the Western Cape. There's people like Jason Marcus, Veronica Mitchell. These people are on the ground training healthcare workers and healthcare workers in training how to handle these experiences, how to report them, and how to give real dignified care to people who are giving birth and who are pregnant. But I think that the burden now lies on the healthcare leaders, the policymakers. You know, there's been a huff and puff about this story, about how prevalent obstetric violence is in our country, and the onus lies on people who have power in the space to make sure that they create a healthcare system that is respectful and comfortable for all who attend.
Regan Boden, Bhekisisa contributor, thank you very much for availing yourself this afternoon.